welcome back to Girl Talk. This is the segment you've been waiting for. We're here at Radiance Skin Therapy with the beautiful Ann Hill, and we're gonna get the 101 on Botox today. So we were talking earlier, and I'm already intrigued. None of us like those 11s between our forehead, or the crow's feet, or the laugh
What do you
lines.
call the big ones across the top? That's what I had a problem with.
Thousands?
Your forehead lines, yeah.
So can you tell us a little bit what Botox is specifically and how it works?
Sure. Well, I'm going to give you the general information because there's a lot of big terms that really nobody needs to know.
Sure.
What it is, it's a solution we place in specific muscles to relax them. So what causes lines, like right here, is a repetition of movement, right? Over our lifetime, we frown, okay? Or we raise our forehead, or we smile and we squint, okay?
Perpetually looking for the sun.
Right, exactly. So when we place the solution in those areas, it cuts off that connection between the nerve and the muscle. So the muscle no longer really responds like it used to. And I like to call it relaxing or fatiguing that muscle. We don't really need to paralyze it totally all the time, but we relax it. So we begin to sometimes retrain that muscle to not do those things that we've been accustomed to over our lifetime.
Sure.
So when we relax the lines, relax along with it. And over time, if you consistently don't move that way, you can actually correct and repair the lines.
I bet it's almost like a conscious thought too after maybe you get Botox done on your 11s. Like, it's like, okay, I got this done. You make an effort to relax your face or keep it relaxed.
You don't even have to make an effort. It just doesn't respond without you even feeling anything. So people say, how does it feel? It doesn't feel any different than your face. You just, if somebody says, can you frown? And I'm trying to frown, you don't frown. So I therefore won't get any 11s.
Thank you, Botox.
Yes, there we go.
That's simple. That's great.
Simple.
So I've got a question for you too,
Yeah.
but first I wanted to congratulate you because you just became a certified aesthetic nurse specialist, and there's only 5 in Wisconsin, right?
Yes.
Awesome.
Yes.
Congrats. So you're in good hands.
Thank you.
But that being said, is Botox safe and will it still look natural?
Yeah. So I think that's what a lot of people, they think it looks crazy because we see some of the celebrities out there or people who are really overdone.
Their faces don't move.
Yeah, exactly. And it really, if you look around, most people around town have Botox and they look natural, but you don't know they have Botox, right?
Sure.
So that's what we want you to look like. We want you to look like you. We want you to look natural. And yes, it is safe. It is the #1 cosmetic procedure done in the world. It has been approved aesthetically since 2002, and we've been using it for a long time medically. So when I used to work back in Peds ICU, we used to do Botox in cerebral palsy's kids' legs to relax the muscles. So it's been used and it still continues to be used, and it is the most studied drug in the world. So if really there is problems with Botox, we would be hearing about it every day.
A long time ago.
And
A long time ago.
You
Yeah.
mentioned the relaxing component to it. I've even heard people that say that it has helped relax, let them and like relieve some headaches and things of that nature, which is a really interesting, side benefit that not a lot of people use it for. But I'm curious about the length of results. So how often do we need to get Botox? How long does it last?
Yeah, well, a norm, okay, is probably 3 to 4 months.
That's
But
pretty good.
some people's metabolism, and it really is a metabolism through your muscle of the product. And so some people we call churn and burn it really quickly, and they're in here every 3 to 3.5 months. And other people I have in here every 6 months. But it is your treatment, and just because we say it's a suggestion, it's all about you. It's what you want out of it. Exactly. So maybe somebody who's in their 20s, you come and get it once a year because you have 4 months of non-movement. That could be enough to repair a little bit and to fatigue those muscles a little bit, and then you don't get it for another year. So it's really what you want.
Sure. So aside from the eye area, is there any other place Well, you mentioned in patients, but any other place cosmetically that you can get Botox in?
Right, so FDA cleared, we all are about that, right? It's your glabella and your crow's feet. But we've been using it off-label for years and years. So we've been doing crow's feet before the FDA approval last year. Okay. But we use it in the forehead lines, all the way around the eyes, even including like a little brow lift. Honestly, I use it a lot in the lower face. We start to pull here.
Sure.
We've got in this muscle chart, our depressor anguli oris here. And that starts to pull. We start to get marionettes, so it can help that. Our mentalis muscles get quite strong, and we develop this bulb type, and then we start to get a line here. Around the mouth area, in the bunny line area. There's a lot of places that we use it, and even in the platysmal bands in the neck.
They have such cute names for these awful wrinkles. The bunny
Bunny
line,
line.
right?
11.
Or the crow's feet, right?
Yeah.
What does that have to do with a crow?
I've relaxed my whole face since I started talking.
Exactly.
Interesting. Well, that's neat. Very, very cool stuff, and I think it's just really informative because I actually didn't realize until recently that you could get Botox in anywhere else but your forehead. So I didn't even realize there was other areas of the face that we could prevent aging.
Is it really expensive, or what kind of cost is involved?
You know what, it's sold by the unit. So the expense comes in, like, let's say you did here, and we did here, and we did here, and we did here. Well, that's more areas, which means more cost. But it's sold by the unit, so you get exactly what you need, and you're not paying for anything more than what you need.
But it sounds like maybe if you come in younger as kind of a preventative measure, it's going to end up saving you because you kind of train your face not to keep
Right.
making that deeper line.
Right, and the lines haven't really formed, so if you do that, it is very much a preventative.
Well, I'm sold. Thank you so much, Anne.
Thank you.
It's been such a pleasure being at Radiance Skin Therapy off Todd Drive. Please check them out. She definitely knows her stuff. And catch us next time on Girl Talk.